Thank you very much, Lesroy. And I know that the CMO, Dr. Hazel Laws, is looking right now. I just want to wish her a pleasant and restful and well-deserved vacation. We continue to update you on a daily basis with the situation report. And we're happy to come here on a weekly basis to inform you as to what's happening. Recently, there were a lot of complaints, rightfully so, about the backlog that we were experiencing. And this was because our testing system was overwhelmed. We have spoken on many occasions about protecting the health system and making sure that we don't overwhelm the health system. We saw around the world, in the UK, North America, and Europe, when they had a significant increase in their waves, that the healthcare system became overwhelmed, such that they had increasing number of hospitalizations, deaths, and there were persons who were waiting for hospital beds and could not get a hospital bed. We were happy that while we were going through our wave and continue to go through our wave, we have not gotten to that point, and it was just our testing system that was challenged. We apologize to the persons who were inconvenienced because of this. We know that there were some persons who were kept in quarantine or isolation for an extended period of time, and we apologize deeply. We, however, addressed the backlog by outsourcing some of the testing. And we also, during the period, attempted to increase our laboratory testing capacity. I'm happy to report that we now have 4 labs in the Federation of St. Kitts and Nevis that are doing RT-PCR testing. The Joseph and France Hospital is back on board with a capacity of 120 to 140 per day. The Next Generation Lab, a capacity of 150 to 300, and Avalon, the capacity has increased since the last time I made the presentation to 150 to 200. And Quality Diagnostics, they're currently at 8 to 12, but very soon they'll be getting some additional machines, and we expect to hear great news over the next week or two about increased capacity at the Quality Diagnostic Laboratory. The samples, as I said, were sent overseas to address the backlog. We need to change the slide. To address the backlog. And the backlog was mainly from samples collected between September 21st to September 30th. There were 1,174 tests that were sent overseas for testing, and the results came back. We had 112 of those samples that were reported as positive, and 1,062 were reported as negative. We were able to report 145 recoveries during this period, and to date, 358 from that backlog of persons were released from quarantine. And so we're happy that persons who were desperately waiting to be released, that they were released. And this information will be reflected in the situation report of the 5th, which should be circulated just about now. But just to give you the information that would be seen on that situation report, as of Tuesday, the 5th of October 2021, we added 61 new cases. So the total confirmed cases in the Federation of St. Kitts and Nevis would go to 2,246. 380 of these are in Nevis and 1,866 in St. Kitts. There are currently 1,073 active cases, 107 in St. Kitts, in Nevis, and 966 in St. Kitts. The number of cases recovered is 1,157, 271 of these in Nevis, and 886 in St. Kitts. We have a total of 23 hospitalizations between St. Kitts and Nevis. 4 are in Nevis, 19 are in St. Kitts. There are currently no patients on the ventilator. However, of the 19 that are in St. Kitts, 3 are very ill. And again, we continue to make the appeal to persons to get vaccinated, because that is your best chance of decreasing your risk of being hospitalized. The Federation has a total of 16 deaths related to COVID-19 thus far. Can we get the next slide? This slide shows you the two waves that we have recently gone through. The first part of the graph shows you the peaks and where the troughs came back down, and the second part of the graph is showing you the current wave that we are going through. We appeared to have peaked in the center and was coming down. However, we had an increased number of cases reported over the last 24 hours, which was 61. I do hope, though, that we continue to see the general downward trend. The number of cases that we've been seeing based on the age group, it continued to affect mainly the young persons. We see that we need to change the slide. We see that the majority of persons who are currently being infected are young persons between the age of 20 to 29. That represents 17.3%. But most persons are between the age of 20 and 40. And these are the persons who are up and about, moving around, etc. And so we encourage you when you're out to make sure that you continue to adopt the non-pharmaceutical measures, because the virus cannot move from point A to point B without you moving. And so if you're going to move, you need to make sure that you move in a safe way. As it relates to the deaths that I spoke about, we said that we had a total of 16 deaths. 14 were in St. Kitts, 2 in Nevis. And of these 16 deaths, only 2 were fully vaccinated. So the majority of deaths are in the unvaccinated. And these persons, the majority of them had comorbidities. In other words, these are persons who would have had diabetes, high blood pressure, maybe asthma, renal disease, etc. And there is a misconception out there that if you have an underlying condition, you are not strong enough to take the vaccine. That is totally and completely incorrect. The ones who really should be coming forward to get vaccinated are those persons with comorbidities, with preconditions, with diabetes, with hypertension, with heart disease, with kidney disease, with asthma. Because if you got COVID-19 compounded with your pre-existing conditions, the chance of your survival is significantly decreased. And it is sad to say that the number of deaths will continue to rise unless people do what they need to do to protect themselves, which is continue with the non-pharmaceuticals, but more importantly, getting vaccinated, which offers you the best protection. As it relates to the ages, we had 1 between the age of 30 and 39, 5 between the ages of 40 and 59, and 10 over the age of 60. And so you can see that no age group really is immune, and we need to make sure that we do all we can to protect ourselves. As it relates to the number of cases and their vaccination status, the virus again continues to find the persons who are unvaccinated or partially vaccinated. Because of all the cases that we've had so far, only 17.3% has been in the fully vaccinated. I am happy that our vaccination program continues to be a success. And as of yesterday, the total percentage of adults who were fully vaccinated was 68.6%, and the adults with 1 shot was 76.3%. And so this is significant as we march forward towards reaching a goal of 80% adults fully vaccinated. Our 12 to 17-year-olds, they are coming forward also, and as of yesterday we had 3.7% who were fully vaccinated and 9.1% with 1 shot. We can see that persons are coming forward to accept the Pfizer-BioNTech vaccine, and we have a total of 1,367 persons, adults and children, who have received 1 shot, and a total of 876 who are now fully vaccinated with the Pfizer vaccine. Again, we said that there is no barrier to vaccination in the Federation of St. Kitts and Nevis. You do not need to call to make an appointment. Just today, I had to make this point again to about 4 or 5 persons who told me that they thought they had to call the clinic to make an appointment. You do not need to make an appointment. You just show up. during the hours that are designated for vaccination, and you will be vaccinated. So again, I encourage everyone who can be vaccinated to go out and get vaccinated, as this is your best chance at survival. I think it's important for one to try and get the digital version of the card so that you can always have it with your technological device, whether it's your cell phone, your iPad, etc. And it's very easy for you to get your digital version of the card. You simply need to visit the Ministry of Health at the Bladen Commercial Complex. When you go there, you will bring a government-issued ID along with your immunization card, okay, for validation. You will be provided with an HID number, which is a health identifier number, and so everyone who would have been vaccinated, you would have had a 7-digit number, and it's on your card. You don't have to try to memorize it. You will then be directed to the website, myvaccinerecord.gov.kn, and when you click on that website, you will see, as you see on the right side of the screen, a box where it will ask for your name and your date of birth and your HID number. Once you click retrieve your record, you will see, next slide please, you will see your vaccination card that will come up, and this is my vaccination card, and as someone who is a public figure, health professional, I have no problems in sharing the fact that my status that I'm vaccinated, and I believe everyone who can should. Let's move on. Now, we have plans to take the vaccination program into the schools. Just yesterday, there was a virtual meeting between members of the Ministry of Health and executives in the Ministry of Education. Present in that meeting, we had all heads and deputy heads of the primary and secondary schools and persons from the Early Childhood Development Program, where we spoke about the vaccines and the plans to educate our parents and teenagers about the vaccination. We would be having a number of virtual PTA meetings with the parents and guardians who need more information about the vaccine. I can tell you that the first one is scheduled for tomorrow evening at 6:30. We'll be speaking with a number of the schools virtually and answering questions from the parents. And within the following week, we should be scheduling sessions where the teenagers can come in with their parents or guardians to be vaccinated. However, one doesn't have to wait for these PTA sessions because there are a number of adults who have done the research themselves, they have made up their minds, and they know that the vaccines are safe and effective, and they have been bringing in their teenagers to be vaccinated, and we want to encourage you to do that. So you don't need to wait until we come to your school or your class. You can bring your teenager in to get them vaccinated. As it relates to our contact tracing protocols, there are a number of questions that are being asked, and so we have two categories of contacts. You can be fully vaccinated or unvaccinated. For the fully vaccinated contact, you are, of course, encouraged to continue the use of the non-pharmaceutical measures to protect yourself and to protect those who are around you, because that offers you significant protection. You will continue your work or usual activity and will not be placed in quarantine. And so just because someone named you as a contact, if you're fully vaccinated, you will continue to do your usual activities. You will receive one RT-PCR test 7 days post the last time you were exposed to that contact, but it doesn't mean that you'll be home for these 7 days. You will be at the workplace or doing your normal activity. If that test is negative, then you will be cleared from monitoring by the Ministry of Health. If it is positive, of course, then you will go into isolation and you'll be monitored until you're recovered. If the fully vaccinated contact is living with a positive case, the situation still applies. However, the Ministry of Health will do some investigations to see whether or not that person could safely live in the household with the positive contact. If that is not so, then a decision will be made whether or not it is safer to move the positive case out of the house or move the person who is vaccinated out of the house so that there is no risk of spread. As it relates to the unvaccinated or partially vaccinated contact, this is more straightforward. That person will be placed into quarantine for 14 days, and they will be tested at the end of the 14 days. And if they are negative, then they would be released from quarantine. And so for the unvaccinated person who is named as a as a contact, they will only receive one test. That is at the end of the 14 days. Now, what is the risk of the importation of the virus based on our entry protocols? Now, just to summarize briefly, our protocol requires that only vaccinated visitors come with a negative PCR test that is done within 72 hours of travel, and they're kept in quarantine for 4 days and then released if they test negative. Children we know who are unvaccinated or cannot be vaccinated, they move under the umbrella of their parents or guardians. Citizens and residents, they are not prevented from coming back home depending on their vaccination status. However, if they are unvaccinated, they will have to be quarantined for 14 days and receive a negative test prior to release. When we looked at the data for the last month, from September 1st to September 30th, we found that of the 844 positive tests that were returned, 11 of the 844, or 1.3%, were from the inbound passenger, and 833 of the 844, or 98.7%, were from persons in the community. And this tells us that the risk from the inbound passenger is low, and there is therefore more latitude for us to further reduce the quarantine period as the incoming passenger does not offer a significant risk. And so next slide, please. And so we'll wait to see whether or not there is any further reduction in the quarantine period. I know that there are some persons who would be anxious to come home to be with their family and friends for the Christmas season, and they would not want to go and make a booking knowing that they might be locked up for 3 or 4 or 5 days, knowing that they might come on Christmas Eve and not be out for Christmas Day. And we're taking all those things into consideration as we balance lives and livelihood and attempt to make you safe and keep you safe. And so we wait to see what are the new orders as it relates to the vaccination status. This just simply demonstrates graphically what I just said. Again, you can see there was only 1.3% of that 844 from the inbound passenger, and 98.7% were cases from in the community. Next slide. Now, I'm going to use the education corner to tell you briefly about the antigen test. The World Health Organization recommends that all suspected cases be tested for SARS-CoV-2 or COVID-19. And the gold standard, as we've said many times before, is the RT-PCR test. But the antigen detection and rapid diagnostic test is finding greater use in the management of SARS-CoV-2. Next slide. So these antigen test kits, they detect viral proteins. The sample is taken from the nose or the throat, just like the sampling for the RT-PCR test. And these tests are cheaper than the PCR test and will offer results more quickly, although they are generally less accurate. These tests perform best when there is more virus circulating in the community, and when samples are taken from individuals during the time when they're most infectious. And what we want to do is to use a rapid antigen test that has a fairly high sensitivity and specificity. And so any test that is being recommended by the World Health Organization should have a sensitivity of greater than 80% and a specificity of greater than 97%. Okay, and this is compared to the RT-PCR test, and we know that the antigen test does not require any significant laboratory infrastructure, so it's easy to perform. Now, questions will be asked then: how, when, and where would these tests be performed. And speaking in general, giving you information as to what's the recommendation by the World Health Organization. According to the WHO, the rapid antigen tests are used to detect acute SARS-CoV-2 infection and are best used for, and there are 4 settings that they can be used for. A, in case finding as a primary case detection tool for testing suspected cases of our COVID-19. And they can best be used in many settings, for example, in healthcare facilities, in testing centers, in care homes, in prisons, in schools and communities, etc. And more they're finding a role in these settings. They also can be used for contact tracing among the asymptomatic contact cases, where you can get your results quite rapidly. We need to move along. They can also be used to investigate outbreaks. For example, if there was an outbreak in a nursing facility, in a school, in a prison, on a cruise ship, in the workplace, or in dormitories. And so they're finding more and more use in these settings. They can also be used to monitor trends in disease incidence in communities, and particularly among frequently exposed workers, including healthcare workers, irrespective of the symptoms. It's important to note that the rapid antigen tests to be considered, or if they're going to be considered, will be done in collaboration with the RT-PCR test, which is the gold standard. And any test that would be considered would be approved by the World Health Organization or the FDA. And there's a long list of these tests that could be found on the WHO site, and I'm pretty certain that our local labs are looking at these sites to position themselves as the science evolves and they become more in use. I want to end by speaking just briefly again to the persons who are affected by SARS-CoV-2. We know that there are only 20 plus persons in hospital, but there are a number of persons who are outside at home fighting the disease. I want to encourage you to stay in contact with your case manager. You also need to stay in virtual contact with family and friends, because being locked up at home, it can have significant psychological deleterious effects on you. I know just being quarantined for 4 days when I traveled and came back, it was distressing. And so for persons who are there for 14 days, 20 days, 21 days, it can be distressing. I want to point out too, though, that sometimes we might hear of someone who is complaining that they have been in quarantine for 21 days or a month. And sometimes it's important for you to get the real facts. It's not necessarily that those persons are being kept for 21 or 30 days because of any backlog. You might have, for example, an adult who might go into quarantine or isolation because they tested positive. And on day 14, when they are ready to be released, they might have a child who tests positive, and that child cannot isolate by themselves. And so they would have to make a decision to remain in quarantine with that child or family member. And so they would be absorbing the risk associated with that child. And so their quarantine period can be extended to a further 14 days. And so it is perceivable how someone can be in quarantine for 28 days, not because of any delay from the Ministry of Health, but because they had to absorb the risk of a family member who could not be quarantined by themselves. And so we need to make sure that we continue to offer as much support to these persons when they are in confinement for such a long time. We want to encourage you to boost your immune system by trying to eat healthy, maintain your hydration, to get adequate rest, and to continue to exercise and to take your vitamins and supplements. Most importantly, however, we want to encourage you to take the best tool that can protect you from severe disease, hospitalization, and death, and that is the vaccine, while you continue to wear your face mask at all times, especially when you're in public, and to continue with the hand hygiene and maintaining adequate distance from persons when you're out in public. And if you're ill, it's important for you to stay home so that you don't continue to spread the virus. What I want everybody to understand, that we are all in this fight together. And when we see the numbers rise, these numbers are not the Ministry of Health numbers. These are the numbers for the Federation of St. Kitts and Nevis, and we are all affected. And we can do all that we can also to make these numbers come down. And so the reaction should not be to finger point and point blame. This is one time in history where the singular action of an individual can affect all of us collectively. And so whether you are large or small, rich or poor, black or white, old or young, your action can affect the entire nation. So I want everyone to try and stay safe and abide by the non-pharmaceuticals. And if you can be vaccinated, go out and get vaccinated. I thank you.